Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about liposuction. Liposuction is a plastic surgery procedure that removes extra fat from the body. It is also called lipoplasty, or body contouring. It is considered a popular cosmetic option. People get liposuction to improve the shape or contours of their body. The idea is to remove excess fat from the areas such as thighs, hips, buttocks, abdomen, arms, neck, or back to get rid of these fat deposits. Liposuction is not a weight loss treatment. It has serious risks and possible complications, so it's important to talk to your provider before considering it. The liposuction procedure requires going under anesthesia, meaning you won't feel any pain during the liposuction surgery. However, pain is expected after the procedure, and recovery can be very painful. Depending on what parts of the body require liposuction, you may have a shorter or longer hospital stay. Some procedures can be done in an outpatient center. It is common to have pain, swelling, bruising, soreness, and numbness after liposuction. To minimize pain before the procedure, you can talk to your healthcare provider about pain concerns, discuss the type of anesthesia that will be used, and ask about any medications you can take before the procedure. To minimize pain post-procedure, take all the prescribed medications, including pain pills, wear the recommended compression garments, keep the drains after surgery in place based on your doctor's recommendations, rest and try to relax, drink your fluids, and avoid salt, which can increase swelling or cause edema. Ideal candidates for liposuction include people who don't have a lot of excess skin, have good skin elasticity, have good muscle tone, have fat deposits that won't go away with diet or exercise, are in good physical shape and overall health, aren't overweight or obese, and don't smoke. You should avoid liposuction if you smoke, have a chronic health problem or problems, have a weak immune system, are overweight, people who have saggy skin, have a history of diabetes, cardiovascular disease, deep vein thrombosis or DVT, or seizures, or take medication that increase the risk of bleeding, such as blood thinners. Liposuction comes with multiple risks, and it is extremely important to discuss all the risks of liposuction with your provider before having the procedure. The risks include puncture wounds or injuries to other organs, anesthesia complications, burns from equipment, nerve damage, shock, and even death. Potential risks immediately after procedure include blood clots in the lungs, too much fluid in the lungs, fat clots, also known as fat emboli, infections, hematomas, known as bleeding under the skin, seromas, known as fluid leaking under the skin, edema or swelling, skin necrosis or death of skin cells, reactions to anesthesia and other medications, heart and kidney problems, and possibly death. There are also potential risks involved during recovery, and these include problems with shape or contours of the body, wavy, dimpled, or bumpy skin, numbness, bruising, pain, swelling, and soreness, infections, fluid imbalance, scars, changes in skin sensation and feeling, skin color changes, and problems with healing. There are potential long-term side effects associated with liposuction, and they can vary. Liposuction permanently removes fat from cells from targeted areas of that body. If you gain weight, the fat will be stored in different parts of the body. The new fat can appear deeper under the skin, and it can be dangerous if it grows around the liver or heart. Permanent nerve damage and changes to skin sensation can also occur, and the possibility of depressions or indentations in the area that were suctioned or may have bumpy or wavy skin that can be permanent. It is important to understand that liposuction is elective, and it's a cosmetic procedure that has major risks. It is not a substitute for weight loss, and not everyone is a good candidate for it. Make sure you meet with a board-certified plastic surgeon and discuss the potential complications and risks before the surgery. If you have any questions or comments on what we discussed today, or if you have a topic that you'd like to learn about, please leave them in the comment section below and we will get back to you. Remember to follow us on Facebook or on our website, The Boca Voice. I'm Dr. Amy Schreibman, and see you next time on Medical Minutes.